Welcome to this lecture on behavioral health emergencies. Today, we'll be discussing the myths and realities surrounding behavioral health, how to approach a behavioral crisis, and the role of EMTs in assessing and managing these emergencies. Let's get started. At some point in life, most people experience an emotional crisis. However, this does not necessarily mean they have a mental illness. As an EMT, it is essential not to jump to conclusions when assessing a patient. Behavioral health crises can have many underlying causes, and our job is to provide compassionate and professional care. One common misconception is that feeling bad or depressed automatically means someone is sick. In reality, many life events, such as divorce, the loss of a loved one, or personal struggles, can cause feelings of sadness or depression. These are normal human emotions, and distinguishing between temporary emotional distress and a true mental health disorder is important. Another misconception is that all individuals with mental health disorders are violent or unmanageable. In reality, only a small percentage of individuals with mental health conditions exhibit violent behavior. However, EMTs may encounter a higher proportion of violent patients due to the nature of emergency calls. Effective communication is key, and in many cases, you may be able to predict and de-escalate potentially violent situations. Behavior is what we can observe about how a person responds to their environment. Over time, individuals develop ways to cope with stress. However, sometimes stress becomes overwhelming, and normal coping mechanisms fail. When this happens, it can lead to a behavioral crisis, requiring intervention. A behavioral crisis occurs when a person exhibits agitated, violent, or uncooperative behavior that poses a danger to themselves or others. As EMTs, we must recognize these situations and respond appropriately to ensure everyone's safety. If a disturbing pattern of behavior persists for a month or more, it is a serious concern. When a behavioral health emergency arises, patients may show signs of agitation or violence and could pose a threat to themselves or others. Our role is to assess the situation and provide care while ensuring the safety of everyone involved. Mental health disorders are widespread in the United States, affecting millions of people every year. A psychiatric disorder is an illness that causes psychological or behavioral symptoms, often impairing daily functioning. One of the most common types of psychiatric disorders is anxiety. Anxiety disorders come in various forms, including generalized anxiety disorder, panic disorder, social phobias, post-traumatic stress disorder, and obsessive-compulsive disorder. Each of these conditions presents differently and requires appropriate recognition and response. The U.S. mental health system offers different levels of assistance based on the severity of the condition. Counselors may help with marital or parenting conflicts, while psychologists handle more complex issues. In severe cases, psychiatrists may provide treatment, including medication management. Most mental health conditions can be managed through outpatient care, but some individuals may require hospitalization in specialized behavioral health units. Understanding these different levels of care can help EMTs navigate treatment options and refer patients appropriately. Behavioral health disorders can have multiple underlying causes. Social and situational stress, diseases such as schizophrenia, physical illnesses like diabetic emergencies, substance abuse, and biological disturbances all play a role. As EMTs, we must consider all possible factors when assessing a patient. As EMTs, we are not responsible for diagnosing the specific cause of a behavioral crisis. However, we should understand the two main categories of diagnoses used by physicians: organic and functional disorders. Recognizing these distinctions helps us provide better care. Organic disorders involve a temporary or permanent dysfunction of the brain due to a physical or physiological disturbance. Examples include sudden illness, traumatic brain injury, seizures, drug and alcohol abuse, overdose, withdrawal, and diseases affecting the brain. Some causes of altered mental status include hypoglycemia, hypoxia, impaired cerebral blood flow, and extreme temperature changes. Identifying these underlying medical conditions is crucial in determining the best course of action for the patient. Functional disorders, on the other hand, affect bodily functions when no structural abnormalities are present. Examples include schizophrenia, anxiety disorders, and depression. These conditions require different approaches compared to organic disorders. In a behavioral crisis, all standard EMT skills apply. Positioning yourself at a 45-degree angle from a potentially volatile patient allows for better visibility and movement while minimizing risk. Understanding patient behavior and responding appropriately can help de-escalate tense situations. When responding to a behavioral emergency, the first step is scene safety. Assess whether the situation is potentially dangerous for you or your partner. If necessary, request law enforcement backup or stage until the scene is secured. Your safety is the top priority. Evaluate the patient's behavior and consider if it is typical for the circumstances. Are there any legal concerns, such as a crime scene or issues of consent? Take standard precautions, and if needed, call for additional resources early in the process. Identify the mechanism of injury or nature of illness. Take note of any medications or substances that may be contributing to the behavioral crisis. Understanding these factors will help determine the best approach for patient care. Form a general impression of the patient. Begin your assessment from a distance and observe their demeanor. Perform a rapid physical exam if needed, and use the AVPU scale to assess their level of alertness. Establishing rapport early is crucial for a successful interaction. Evaluate the airway and breathing. Ensure that the patient's airway is patent and their breathing is adequate. Use pulse oximetry if available, and be prepared to intervene if there are any signs of respiratory distress. Assess circulation by checking the patient's pulse rate, quality, and rhythm. Look for signs of shock, bleeding, or other medical concerns. Evaluate skin color, temperature, and capillary refill as part of your overall assessment. Decide whether transport is necessary. If the patient is medically stable, be prepared to spend additional time on the scene to establish trust and encourage cooperation. However, if the patient is unstable due to a medical or trauma-related issue, transport should be expedited. Investigate the chief complaint and gather a sample history. Consider 4 major contributors to behavioral crises: central nervous system dysfunction, substance use, significant life stressors, and existing behavioral health conditions. Obtaining a sample history can provide useful information for hospital staff. In geriatric patients, consider conditions such as Alzheimer's or dementia. Use reflective listening techniques to help the patient feel heard and understood. Assess whether any underlying medical conditions could be contributing to the patient's behavior. In some cases, a physical illness or injury may present with behavioral symptoms, so maintaining a broad differential diagnosis is important. In unconscious patients, start with a thorough physical exam. If the patient is conscious but uncooperative, nonverbal observations can provide crucial insights into their mental state. A patient's emotional state can be assessed through facial expressions, pulse rate, and respiratory patterns. A blank stare or rapid eye movements may indicate central nervous system dysfunction. If transport is required, coordinate with law enforcement or fire personnel if necessary. Behavioral health emergencies often require transport to a designated psychiatric facility rather than a standard emergency department. Always stay vigilant when working with behavioral health patients. If restraints are needed, reassess the patient every 5 minutes, checking vital signs, circulation, and overall condition. The best intervention in many cases is simply listening. If pharmacological restraint is necessary, request ALS early to ensure appropriate sedation and monitoring. Provide the receiving hospital with a detailed report on the patient's condition. If restraints were used, document the type of restraint and the justification for using them. Thorough documentation is essential in behavioral health cases. Psychosis is a state where the patient is disconnected from reality. Causes include substance use, extreme stress, and conditions such as schizophrenia. Recognizing these symptoms early can guide appropriate management. Schizophrenia is a complex disorder with symptoms such as delusions, hallucinations, erratic speech, and social withdrawal. It typically begins in adulthood and can be influenced by genetic and environmental factors. When interacting with a psychotic patient, determine whether they pose a danger to themselves or others. Remain calm and direct while maintaining a safe distance. Avoid confrontation, as it may escalate the situation. To de-escalate a psychotic episode, clearly explain your actions, avoid arguing, and involve trusted individuals such as family members. Building rapport is essential in gaining patient cooperation. If necessary, request law enforcement assistance or ALS for chemical restraint. Always ensure that the patient's rights and dignity are maintained throughout the interaction. Excited delirium is a condition that involves cognitive impairment, often presenting with disorientation, hallucinations, or delusions. Agitation, characterized by restless and erratic physical activity, is a common feature. Recognizing this condition early is crucial to ensuring the patient's safety. Symptoms of excited delirium include hyperactive irrational behavior, vivid hallucinations, hypertension, tachycardia, diaphoresis, and dilated pupils. These symptoms can escalate quickly, requiring careful de-escalation strategies. Remain calm, supportive, and empathetic when approaching a patient in excited delirium. Move slowly, respect their personal space, and limit physical contact. Never leave the patient unattended, as their condition can deteriorate rapidly. Use careful interviewing techniques to assess the patient's cognitive functioning. Observe their ability to communicate, appearance, dress, and personal hygiene. Gathering this information will help guide appropriate interventions. If the patient has overdosed, transport all medication bottles or illegal substances with them to the medical facility. Whenever possible, transport the patient to a hospital with behavioral health resources and refrain from using lights and sirens, as this can increase agitation. If the patient's agitation continues despite verbal de-escalation, request ALS assistance for possible chemical restraint. Excited delirium can lead to sudden death if not properly managed. Ensuring patient safety is a top priority. Every EMS provider should follow their pre-hospital patient restraint protocol. Protocols vary by region, but the chosen restraint should always be the least restrictive while ensuring the safety of both the patient and providers. Proper training is essential when restraining a patient. Restraining someone without proper authority in a non-emergency situation can lead to legal consequences, including assault, battery, false imprisonment, or civil rights violations. Restraint should only be used when absolutely necessary to prevent injury to the patient or others. Before considering physical restraint, always attempt verbal de-escalation techniques first. When restraining a patient, move quickly and with coordination. Ideally, 5 people should assist, 1 for each extremity and 1 to control the head. A team leader should be designated to direct the process. The level of force used should always be the minimum necessary. Factors to consider include the patient's size, strength, and mental status, as well as the type of abnormal behavior they are exhibiting. Talk to the patient throughout the restraint process. Treat them with dignity and respect, and when possible, have a same-gender provider attend to them. Always wear appropriate barrier protection. Avoid direct eye contact and respect personal space to reduce escalation. Never leave a restrained patient unattended. 4-point restraints, both arms and both legs, are preferred for maximum control and safety. Once the patient is restrained, continuously monitor for signs of distress, including vomiting, airway obstruction, respiratory distress, circulatory impairment, or changes in level of consciousness. Document all restraint procedures carefully, noting the time restraints were applied, the justification for their use, and any patient responses. Regularly reassess the patient's condition and adjust management as needed. Ensuring transparency and adherence to protocol protects both the patient and providers. Only a small percentage of behavioral health patients become violent, but recognizing early warning signs can help prevent escalation. History, posture, and scene cues provide important indicators of potential violence. A history of prior violence or aggression is an important factor to consider. Observe the patient's posture. Are they tense, rigid, or positioned on the edge of their seat? These cues can indicate heightened agitation. Assess the scene for potential weapons or hazardous objects. Be mindful of vocal activity. Aggressive, erratic, or loud speech may be an indicator of distress. If necessary, request law enforcement backup to ensure safety. Pay attention to the patient's physical activity. Clenched fists, tense muscles, pacing, or failure to sit still are strong signs of potential violence. Creating a safe distance while maintaining a calming presence is key. Other risk factors include poor impulse control, substance abuse history, or signs of severe mental distress. Recognizing these signs early can help you take preventative action before a situation escalates. Depression is the leading contributing factor to suicide. It is a common misconception that individuals who talk about suicide never follow through. Suicidal threats should always be taken seriously. Warning signs of suicide include expressions of hopelessness, avoiding eye contact, speaking slowly, and discussing plans related to death. Immediate intervention is necessary when these signs are present. Look for additional risk factors, such as access to weapons, prior suicide attempts, or sudden changes in mood. If a patient mentions suicidal ideation, do not leave them alone and seek immediate medical intervention. Ask direct but compassionate questions regarding their intentions. Establishing a support system or involving mental health professionals is crucial in preventing a crisis. A patient expressing suicide risk should always be transported to an appropriate facility. Cultural, religious, or medical factors can also play a role in suicidal ideation. Consider all aspects of the patient's situation while ensuring immediate safety and mental health support. PTSD can develop after exposure to trauma such as assault, abuse, serious accidents, or combat. Military veterans are at particularly high risk, and recognizing their unique needs is essential. Veterans with PTSD may avoid reminders of their trauma, have heightened nervous system arousal, and relive traumatic events through nightmares or flashbacks. Providing calm and respectful care is key. Symptoms of PTSD include severe anxiety, irritability, emotional numbness, and social withdrawal. Many combat veterans may also struggle with hypervigilance and an exaggerated startle response. PTSD is not always related to a single event. Cumulative stress over time can also contribute. A significant percentage of veterans struggle with co-occurring conditions such as depression, substance abuse, or traumatic brain injury. Recognizing PTSD symptoms early allows for better interventions. Be mindful of personal space, avoid sudden movements, and use a calm, non-threatening tone when communicating. Approach with empathy and offer structured support. If a veteran displays heightened distress, removing stimuli such as loud noises or bright lights can be helpful in reducing agitation. If the patient is expressing suicidal or homicidal thoughts, immediate intervention is necessary. Transport them to an appropriate facility for mental health evaluation. Physical restraints should be avoided if possible, as they can escalate distress. Instead, provide reassurance and involve someone the patient trusts whenever possible. Behavioral health emergencies often present legal and ethical challenges. Whenever possible, obtaining patient consent for treatment is ideal. In cases where a patient is not competent, implied consent may apply. An EMT has limited authority to require a patient to undergo treatment unless there is an immediate life-threatening emergency. If a patient refuses care, law enforcement involvement may be necessary. When determining whether a patient requires immediate care, assess their capacity to make informed decisions. If a patient appears to lack mental competency, EMS providers may need to act in their best interest while ensuring legal compliance. Always document decisions thoroughly to protect both the patient and providers. Limited legal authority exists for EMS personnel to force treatment unless an immediate life-threatening condition is present. In psychiatric emergencies, law enforcement may need to be involved to ensure proper care and transportation. Understanding when and how to escalate care is crucial for patient safety. In cases where a patient's mental state is significantly impaired, err on the side of treatment and transport. Courts typically support EMS personnel when acting in good faith to provide life-saving care. Always communicate clearly with medical control and document every step of the decision-making process.